Bush, and I'm here to speak to you about hands-only CPR. Most people who survive a cardiac arrest are aided by the assistance of a bystander. In the next 2 minutes, you could be that bystander that aids assistance to a person that really needs it. Cardiac arrest is an electrical disturbance that occurs within the heart that ceases blood flow to the brain and the rest of the vital organs. Each year, over 420,000 cardiac arrest deaths are reported on the outside of the hospital. When a person has a cardiac arrest, survival depends on getting immediate CPR to that patient. According to the American Heart Association, 90% of people who suffer out of hospital cardiac events die because no one offers help. Most Americans feel that helpless to do anything when they witness this. Today, we can change that. I have a nursing student here that's going to aid me in teaching hands-only CPR. Proper hand technique. The American Association recommends that you find the center of a patient's chest.
Right here?
No, we're going to go a little bit lower. There we are. Center of a patient's chest. Push hard, push fast. Just like regular CPR or conventional CPR, they recommend you doing at least 100 chest compressions per minute, and do this until help arrives, an advanced paramedic, EMT arrive, or until you physically have exhausted yourself.
Am I going fast enough?
Actually, we want you harder and faster. That's it. That's it. Another recommendation is that you think of the Bee Gees' Staying Alive song in your head, and you do it to the beat of Staying Alive. That is correct. That is beautiful. I've taught the nursing student CPR in less than 2 minutes.
Hello? Mr. Blue? Did anyone see what happened? Oh no, he's not breathing and he doesn't have a pulse. Somebody call 911, we need help!
The only requirements that are required at this time is to push hard and push fast, and to have someone go and get help. Send for an emergency or an advanced practitioner such as EMT, paramedics to get help. This hands-on CPR will continue until that personnel gets here and takes over. And there you have it. Within 2 minutes, you could save a life. Great job. He lived. And that is hands-only CPR. Who has questions? Yes, Andy.
Why did the American Heart Association decide to recommend hands-only CPR for cardiac arrest?
Excellent question. The American Heart Association decided to change protocol for bystander CPR in order to encourage more people to do CPR. They figured that time was being wasted with the pulse check and positioning of the head for mouth-to-mouth resuscitation. So just the CPR, the circulation part, is all that is needed now until an advanced team gets on site. Are there any other questions? Yes, Veronica.
Is hands-only CPR just as effective as conventional CPR?
Great question. Hands-only CPR has been proven to be just as effective, and in some cases even more effective than conventional CPR. Do we have any other questions?
Has the American Heart Association changed their recommendations for healthcare providers?
Excellent question, Rebecca. The American Heart Association has not changed their protocol for in-hospital or CPR for healthcare professionals. It is still, we are still to use ACLS and BLS protocol. Thank you. Thank you all. So now, who's ready to go out and do CPR?
Me!